into 5 meals, but the same amount of food. Is that correct or not?
It will affect the teeth.
The teeth.
Yeah, it will affect the teeth, of course. But 5 times, maybe it's not too much. But if you notice,
so the less, the better.
The less, the better. If you notice now the community, what they are doing, we are taking our breakfast, then we go to the work and drink tea. After half an hour, drink tea. After half an hour, drink coffee.
Even drinking tea is a
big problem.
It is.
Anything which has some acidity, the tea has some sugar. Okay, the sugar will make decay again. You can't brush. I don't think nobody brushes teeth after every
cup of tea.
But even if you brush, it will not help too much
really?
In this situation, of course.
Whoa.
The other thing which they are affected with, that let's ask the same question by another way.
Okay.
There are many people who they don't brush their teeth and there's no many decays in their teeth.
Yeah.
Okay. Now there's some genetic problem, which is that the saliva itself, sometimes it is a little bit acidic. Yeah.
So it doesn't help the harder to.
Yeah, sometimes it helps, of course. They need to brush their teeth and control their food more than the others.
Oh.
Because they have already their problem,
Yeah.
that their saliva is a little bit acidic. But if it is alkaline, so it will not affect the tooth like this.
And how can you know that that kind of saliva is like this and the other kind of saliva?
The dentist can know. But let's say when the patient has alkaline saliva, his mouth tends to make some calculus. You know the calculus, the black on the tooth, which some calcium on the teeth from inside.
Really?
The calculus, yeah.
Yeah.
Which the people know it by other names actually here in Saudi Arabia. But the saliva, when it is acidic, it will affect the.
It will affect
the teeth by decays, like it will make some cavities and decays.
Well, yeah, that's true. Well, let's
This
put.
how can we can distinguish between the two things.
Yeah, but that's quite amazing to have. I didn't know before that we have different kind of salivas, and that's quite amazing.
Yeah.
But I think let's put that on a pause because we have a segment right now, and it's all about information. So let's go with that report and just stay and watch it with us.
Chocolate is a raw or processed food produced from the seed of tropical trees. Cacao has been cultivated for at least 3 millennia in Mexico, Central and South America. Its earliest documented use is around 1100 BC. The majority of the Mesoamerican people made chocolate beverages, including the Aztecs, who made it into a beverage known as Anuhotel, which means bitter water. The seeds of the cacao tree have an intense bitter taste and must be fermented to develop the flavor. After fermentation, the beans are dried, then cleaned and then roasted, and the shell is removed to produce cacao nibs. The nibs are then ground to cacao mass, pure chocolate in rough form. Because this cacao mass is usually liquefied, then molded with or without other ingredients, it is called chocolate liquor. The liquor also may be processed into two components, cacao solids and cacao butter. Unsweetened baking chocolate, which is bitter chocolate, contains primarily cacao solids and butter in varying proportions. Much of the chocolate consumed today is in the form of sweet chocolate, combining cacao solids, butter or other fat and sugar. Milk chocolate is sweet chocolate that additionally contains milk powder or condensed milk. White chocolate contains cacao butter, sugar and milk, but no cacao solids. Cacao solids also contain alkaloids such as theobromine and phenethylamine, which have psychological effects on the body. It has been linked to serotonin levels in the brain. Some research found that chocolate eaten in moderation can lower the blood pressure. The presence of theobromine renders chocolate toxic to some animals, especially dogs and cats.
Yeah. Thank you a lot for these quite amazing informations about the chocolate. I mean, I'm that kind of person that likes white chocolate. I find it different and really, really delicious, especially if it's just a little bit crunchy. Well, what do you prefer?
Yeah, no, I prefer the dark chocolate. I
The
don't know
dark,
why.
the
Yeah.
dark chocolate.
Yeah.
I really don't like it.
No, I like the special things. I don't know.
Really?
The taste, yeah.
Because you are special.
Thank you.
So what kind of chocolate do you like, sir?
What I like or
Yeah, what you like.
The light chocolate, of course.
The light chocolate. Really?
Yeah.
You mean the normal one, the brown one, or the white one?
Let's say not the dark brown, the brown one, but it's not.
Yeah, it's not white, but the normal one,
Yeah,
the
the
brown
normal
one. How about you?
White chocolate.
White chocolate,
Yeah,
right?
same.
So 2 on the team. Yeah, I really do like. It tastes different. I don't know, and I'm sure every one of us likes one kind of chocolate that really knows. I mean, there's that saying that they say, eat whatever you want, but address whatever people say that is better.
Yeah.
I think something like that. I don't know. We know that in Arabic, but I don't know why I just said it. Anyway, I think that's it for information today. Thank you a lot for that episode. And yeah, going back to our topic, we were talking, since we mentioned chocolate, does it affect our tooth in a bad way, or is it good? As most of the doctors say, it's good for the heart and for the brain and so on.
The chocolate itself, which is made from cacao,
Yeah.
I don't think that it has some bad effect, but the sugar inside the chocolate, this is the problem. of
So
course.
sugar is really bad for tooth.
Yeah, of course, because it is the
The
place-
reason, the
yeah,
main
of course,
reason.
the main reason of
Yeah.
the cavities, because it's make very strong acidic
Sugar in
medium.
anything. In anything.
How about
Sugar
salt?
in anywhere.
How about salt
No, no, salt it
and
doesn't, no.
salt and what and lemon? They're not
Lemon, of course, if you get more lemon, you can.
It will-
But lemon can be easily resolved by waters.
Oh.
But when you eat chocolate and the chocolate sticks between
Yeah, your
good.
tooth.
Yeah.
two, this is the problem. And you don't wash it, it's a very big problem.
Whoa.
Okay, let's say drinking a tea without sugar. Is that different from drinking it with the sugar?
Of course.
Between meals, can I drink a tea without the
Yeah,
sugar?
let's say less effect, and it's not bad at all. Because even I know that tea has some fluoride material which can make prevention for the decays. But if you can drink it without sugar, of course.
Yeah, I drink it
Doctor-
without
Oh,
sugar.
very nice.
The only reason for the dental cavities is just eating sweets, because I see so many children are so young age, like 4 years or 3 years, and they have cavities and they have to go to the dentist.
Yeah.
And they eat sweets.
Yeah, they eat sweets.
course.
But it's not the only reason.
Yeah,
Even
what are
the
other
milk,
reasons?
when the infants drink the milk all the day, they have their bottle, you know, and they are
Yeah,
drinking
they go all the day, yeah.
Okay, they make some decays for them sometimes.
Really?
Yeah.
The milk
So
itself?
they need to wash their teeth and
Not to
eat 3
organize.
times.
No, for infants, they have to eat
They have to
more.
eat a lot,
But
yeah.
not all the day they have to handle the
on-
bottle.
Yeah, you know,
and,
the
drink
moms, they do it. They just give them the bottle just to make them quieter.
Yeah, it's not good, actually.
Yeah.
It's not good at all.
Since we're talking about little babies, how about that thing that I've heard that affects their teeth? It's not the bottle, but it's that something they call it tetina. That thing,
The thing that they
that
just
with nothing. It's just something you put
Yeah.
it in the kid's mouth just to let him quiet. It affects the tooth. It makes what they call it an open bite.
Yeah, open bite.
Yeah?
Exactly. Sometimes.
I used to have it, but
you
not
don't
from
have
this.
it.
But not, they actually get it from that thing or from their fingers, right?
From their fingers. This is what cause
The open bite.
open bite.
But I actually didn't get it from here or there.
What's
And
an open
the
bite?
reason was my
from the
tongue.
finger is very bad habit.
Yeah.
Actually, and if the patient, if the child still get this habit after 4 years old, it will
turn
cause big
into
problem in his
a serious issue.
Yeah, serious
But the thing is that I didn't get it from the finger nor that thing.